Okay, hi, this is Sia, and my subject is arthritis, and I have here with me Dr. Jolly.
Okay.
Hi, Dr. Jolly.
I think you need to know that I'm 97 years old.
Oh, that's right. He's 97 years old. So thank you, Dr. Jolly, for letting me interview you today. I just want to make sure you know that you are sharing some personal medical information with me, which will be shared with my class. And you're okay with that?
That's very good, yes.
Yes, okay.
Mm-hmm.
So let's get started. Do you know what kind of arthritis you have?
No, but you told me.
The osteoarthritis.
Okay.
So where do you have your arthritis at? Can you?
Oh, this finger here won't straighten up. You see, it's these fingers are straight, but this one won't.
Mm-hmm.
It's like that all the time, and I can't make it go straight at all.
Don't try, remember?
Yeah, and don't try it.
What are some of the signs and symptoms you have?
Well, if I use it too much,
Mm-hmm.
it hurts bad.
Okay.
And if it bends clear around here too far, it gets stuck and it stays there. And I have to pull it out because it hurts really bad. Like, you know, on a scale of 1 to 10, it's like 8 or 9. It's really bad. But if I pull it out, then it only hurts for about an hour or two.
At an 8 or 9? For an hour or two?
Yeah, and then it goes away.
That's pretty painful.
Yeah, it's bad. I should not do that. But if I grab something by mistake, maybe once a week, I'll remember then. Yeah.
So how does it affect your everyday life?
Well, I can't grab things, so I have to use my right hand.
Oh.
Because if I put too much pressure on, it hurts.
Okay. You take any home remedies to ease the ache?
Yeah, and then I use Bengay, which works real good. But it only lasts a little while. You know, maybe 4 hours or something.
Oh, okay.
Yeah. And then I have this other capsaicin, which it works like Bengay. It's stronger than Bengay, and it burns.
The skin? Burns
Yeah,
the
well,
skin?
no, but it feels hot.
Oh, okay.
Feels real hot. Yeah. And Bengay feels cold. And this stuff feels hot like it was pepper. But then it takes care of the pain. Again, only for maybe 4 or 6 hours.
Okay.
Yeah.
Do you take any kind of oral medication for it?
I only take Tylenol, nothing else.
Just Tylenol?
Yeah.
Does it help ease the pain though, the Tylenol?
Oh yeah. Again, you know, 500 milligram of Tylenol will last maybe 8 hours.
Oh, that's pretty good. Have you had any type of procedure or treatments for the arthritis?
I've had injections in this joint right here, but when they stick the needle in, and it's a lady doctor, she's terrible. It goes into the joint, and that's very, very painful. And then it hurts for about 2 or 3 days, and then all the pain goes away, and it stays away for quite a while, like maybe 3 months or 4 months or 5 months, but I don't want to go back anymore.
So the pain of the injection is not worth the 6 months?
Yeah, I think not. Maybe I'll go back again someday, but it hurts. It's terrible to have that needle stick in.
Do you have any advice for those who do have this arthritis?
Well, I suppose it's because my age, or I don't know, maybe I bought something, but all these hucksters know about it, seem to, and I get things in the mail, and I get things on my email where they're trying to sell me something that will make it perfect, that'll fix everything. But when they tell me how many things it'll fix, then I know it doesn't work at all. Yeah, and so you don't want to waste your money on that stuff. They usually want, you know, like $50 a bottle.
Oh, wow.
And it doesn't really work.
Okay.
Yeah.
Well, thank you for letting me interview you
Oh,
for my class.
fine, yeah. Well, if the class can tell me how to straighten that up, that'll be fine.
Not yet. Maybe one day one of them could.
Yeah, maybe,
All right. Thank you so much. And this is it. You guys all have a good day.
Bye-bye.
Bye-bye. Hello, I am Sia. Today I'll be talking about osteoarthritis. Osteoarthritis is a degenerative joint disease, also known as wear and tear arthritis. It occurs most frequently in the hands, hip, and knees. Over 30 million U.S. adults are affected by this disease. Some of the factors are joint injury, overuse, age, gender, weight, genetics, and race. Injury or overuse, such as knee bending and repetitive stress on a joint, can damage a joint and increase the risk of osteoarthritis in that joint. The risk of developing osteoarthritis increases with age. Women are more likely to develop osteoarthritis than men, especially over the age of 50. Extra weight puts stress on joint, particularly weight-bearing joints such as the hip and the knee. The stress increases the risk of osteoarthritis in that joint. People who have family members with osteoarthritis are more likely to develop it. Some Asian population have a lower risk for osteoarthritis. The causes of this disease is the damage or breakdown of a joint cartilage between bones. The signs and symptoms are pain or aching, stiffness, decreased range of motion or flexibility, and swelling. To diagnose osteoarthritis, your doctor will examine you for tenderness, warmth, and swelling around the joint or joints. Your doctor can also perform a arthrocentesis, which is the removal of synovial joint fluid to examine. And your doctor can also perform a arthroscopy, which is inserting a viewing tube into the joint. Your doctor may also order an x-ray. You can see in this x-ray picture that the normal knee has a little space in between the bone where the cartilage is supposed to be, and the knee with osteoarthritis has no space in between the bones, and it just looks like the bones sitting on top of each other. Your healthcare professional may also order blood tests to look for evidence of another arthritic condition. There are no cures for osteoarthritis, so doctors usually treat osteoarthritis symptoms with a combination of therapy, which may include the following: increased physical activities, physical therapy with muscle strengthening exercise, weight loss medication, including over-the-counter pain reliever and prescription drugs, supportive devices such as crutches or canes, and surgery if necessary. The prognosis of patients with osteoarthritis depends on which joint are affected and whether or not they are causing symptoms and impaired function. Some patients are unaffected by osteoarthritis, while others may be severely disabled. Joint replacement surgery for some results in the best long-term outcome. You cannot fully prevent osteoarthritis because it is a result of using your joints every day. The older a person gets, the more wear and tear happens. But you can help lessen the daily stress on your joints by keeping a healthy body weight, controlling your blood sugars, be active every day, and try to prevent injuries to your joints. Thank you for watching my video. I hope you guys learned a little bit about osteoarthritis. I got all my information from the CDC website and the University of Rochester Medical Center website and the Harvard Health Publishing website.